Welcome to the New Future of Work, a series brought to you by Harvey, Nash and Spinks, exploring what the new normal might look like. And we're doing that by talking to senior technologists, business leaders and talent leaders from across the globe. This episode, the second in the series, is all about the new shape of the workforce, and we've got three fantastic guests to help us do that. So I'd like to introduce Nicky Clarke, who's the Chief People Officer at the Northern Care Alliance NHS Group, Chris Robinson, who's a highly experienced Exec Director, Chief Technologist, Digital and Engineering Leader, who's currently working at IQEQ, and finally Bev White, who's the Group CEO at the Harvey Nash Group. So thank you, the three of you, for joining me on today's conversation about the new shape of the workforce. Nicky, I wanted to come to you with the first question. You work within the NHS, which I suppose is an organisation that at times you kind of imagine public sector might be a little bit slow to change, but you have said that you've had to really accelerate the rate of change within the organisation. In terms of new working practices, how breakneck has that speed of change been, and how long do you think it would have taken for your organisation to have made those changes under normal circumstances?
It's been incredibly fast. So one of the things I would observe since I've been in the NHS is we've been working for years on how to transform how we deliver outpatient services, for example. So we have a very traditional model. People come into the hospital, they sit in a waiting room, they wait, and then they might have to wait for another appointment. In the last few weeks, we've transformed. So about 80% of our outpatient appointments are now being held virtually, either on the phone or through video calls. We've actually managed to determine that quite a few patients actually didn't need follow-up outpatient appointments. So clinicians have made different decisions rather than just being automatically into a routine. And I just, the change has been incredible and incredibly fast. And, years, so all 7 years I've been in the NHS, we've had an outpatient transformation programme on the efficiency agenda each year. And yet in weeks we've managed to do that. The important thing will be, how do we retain that innovation and creativity that people have come up with into the future now? Because what we mustn't do is fall back once people can visit hospitals again and things, and go back to the old ways of working. So getting clinicians to accept that we've now shifted and they can't go back will probably be the next challenge.
I mean, that's an interesting point, and it's probably true whether you're public or private sector, right? I mean, Bev, you're CEO of the Harvey Nash Group and reasonably new in that role, right? So I suppose you're coming in and seeing it with fresh eyes. I suppose you would have brought innovative ideas, but now also this situation is creating innovative ideas, and you don't surely want to lose the opportunity to see those press through the organisation either when we return to normal.
Yeah, exactly. David, it's interesting, a lot of what you're saying, Nicky, I can see that in my previous incarnation of what I used to do. But coming into this business, I mean, it's in its very nature. I mean, it's used to change and working with clients at change at speed. But I think what we needed to do really rapidly was to work more closely together instead of in the separate businesses. And I think that's been a real advantage, because from that, fresh ideas are coming out fast and thick, and not just ideas, but then moving them through to implementation is happening at incredible speed. So I'd hate to lose that too, Nicky, to your point. I think what we've got to kind of remember is probably what might have held us back, and I guess that might be where we go on this, is, the kind of risk and governance profiles that you always have to place on any change program. And in this COVID crisis, they've gone out of the window. I mean, obviously we do things safely, but on the whole, there's an imperative to move at speed, and kind of manage the risk carefully alongside that.
Chris, do you think it's a surprise to see how flexible organisations have been? And I suppose industry as a whole. I mean, you get a slightly broader view, I suppose, than just one organisation in the business that you work in, right?
Yes, I think it's. I think if we're talking a broad change, there's always that slightly cliched thing, which is, people, process, technology. The technology being the easy bit, and here it's been a great testing case for that, because suddenly I mean, I've worked in professional services for the last sort of 10, 15 years. Culturally, a lot of senior management has not been comfortable with the majority of the staff working from home, certainly not 100% of the time. And that was forced upon the organisation. And then that was a great test case. Well, how easy it is to get the technology working. And I think a lot of people have been very surprised that within 2 or 3 weeks, we went from 10% of the workforce able to work from home to 99%, because the tech is there nowadays. I mean, if this had happened 15, 20 years ago, we'd be in a different situation. So the cultural part was forced on the organisation. I think in normal circumstances, that would have been a 1, 2, 3, 4, 5 year push to try and get governance, cultural change, ways of working changing. The tech would have been easy to do. So I think here it's forced the organisation to move to something far quicker than it would have done. And a lot of people are now very surprised that, we look at what we measure, which is obviously the chargeability of our staff, and it's at 97, 98% of what it would have been if they're in the office. So, very quick change, and I think that will substantively change how we structure our workforce and ways of working going forward.
So we've been thinking about that. We've got a lot. We haven't got all our people working from home, obviously, but we have got a substantial number of some of the support staff working at home. I think the challenge that we're now thinking about is actually the longer term effects of so many people working at home, from their own well-being, their own mental health, the lack of social contact, if that makes sense. Because whilst they've got families at home, potentially at the moment, at some point they may all start going back to work in different places, children will go back to school, and actually they potentially are then on their own at home, which is a different environment. And I think there is something about, whilst everyone's sort of done it at pace and is okay with it because actually it's a good solution in current circumstances, I think there's much more to think about in terms of how we support working at home in a much more substantial way. We've put lots in place, but I don't think we've done a good enough job yet to truly change the culture and keep the connectivity, the human connectivity, if I can
Just out of interest on that point, I mean, Bev, when we were preparing for this conversation, you mentioned, I think, about, traditionally young parents might have relied upon help from their family. And I suppose, when we're talking about well-being, and we have gone from 0 to 99% on this, and all of a sudden everyone's working from home, but there are new pressures being placed on family life that aside from just being isolated, I don't have kids. I hadn't really thought about the fact that if you have elderly parents, they might have been your go-to when you need childcare or so on and so forth. So have organizations fully considered the range of pressures being placed on the workforce and building, I suppose, on Nicky's points around kind of, well-being and the way that people are feeling about this?
I think on the whole, most organisations I've spoken to, ours included, have really incorporated the fact that, we have multiple things to do when we're based at home in these circumstances. So to be flexible on the times people are, on the work versus having to, follow up on family commitments, run the virtual schools, look after little toddlers and so on. And it strikes me that actually this really gives us so much more flexibility going forward to be even more diverse in the way that we consider our workforce, be much more flexible and inclusive. And actually, I love the fact that, it's proven what I always suspected, that fundamentally you focus on outcomes, not hours spent. And, I think for me, this offers us a greater choice for the future. I'm really excited about it.
I'd be really interested. I don't think this one's necessarily easy to answer, but Chris, traditionally the white collar jobs have been better suited to working from home. If we're moving towards an economy where lots of people are based from home, does that further stretch, I suppose, the haves and have-nots and the socioeconomic makeup of our workforce? Or are there chances to offer opportunities here to disadvantaged communities and minority groups? And, you mentioned that the technology exists, but not everybody has access to that technology necessarily.
Well, there's a lot of questions in there.
Sorry. I appreciate this one is not easy.
And access to technology, you're right. I mean, we have taken a view that, everyone has broadband, everyone can go home and just plug in and do that. And there are certain people who say, I've relocated from another country, I don't have a broadband contract. There are obviously in the community, not in our current workplace, people who can't afford broadband and other things, and opportunities down the line to try and look at that infrastructure and make that available to all is a whole socio-economic discussion. We're going to come on to automation. I am in a white collar industry, but one of the big opportunities for employers, not necessarily advantageous to the employees down the line, is this has also created a discussion around how quickly we move forward with automating a lot of the tasks. I'm in fundamentally an accounting business, and if you look at any stats, accounting and those sorts of tasks are probably the number one task from a white collar space that can be automated. So I think there are opportunities, you're right. Whether or not some more disadvantaged people can take advantage of that, I think there will be those, because the commute in terms of difficulty of getting into work for certain people who have difficulties with mobility, for example, that will change. The skill set required, however, for sort of white collar jobs is always going to be, driven by the educational framework and the socioeconomic framework rather than the technology or anything else. So I think there are going to be less jobs, and I think if you look at the economic circumstances and where the economy is going, whether that's over the next year or two, there are definitely going to be less companies and less jobs. I think there's going to be more automation, and you put all of and more robotics in sort of blue collar jobs. So you put all that together, and I think it's probably going to be harder for a lot of people to secure work. So whether the haves and have-nots get better in this economic climate, I'm dubious.
Bev, sorry, you were keen to build on that.
Yeah, I think the whole area is really interesting. As Chris has said, unemployment almost certainly will continue to rise now, and whether that's for a long sustained period or even a short period, I think from a skills building perspective, I think there's a real opportunity now for organisations to offer entry-level programs, ours included actually, with partners, to help people perhaps get into a technology world, if that's what they would be interested in doing, and get into perhaps a new career, one that might be more suited to the lifestyle they really want, more flexibility and so on. But I'm really interested in the fact that we can actually offer something to people, very positively, rather than another job in the same sector, perhaps a different job with more sustainability behind it.
Nicky, your role as kind of has that people slant to it. Is that something that you can kind of see working with the NHS as well? I mean, the one thing that we've always kind of had in mind is trusts can operate quite differently, and there is huge opportunities there to embrace, as Bev is saying, kind of bringing people into new careers, but equally it's going to take a lot of joined up thinking, and that might be tricky, I suppose, in the larger kind of public sector organisations to really take advantage of that opportunity, right?
It is, particularly in an organisation where a massive proportion of our staff have to go to work, because you can't work from home and look after patients. So just prior to COVID, we've been working for about 6 months on an anchor institution programme. So trying to work really closely with our communities. So we're in 4 communities around Manchester, to try and look at how we could support the disadvantaged elements of the community, both from an education point of view, pre-employment programmes, and targeting those groups and working with schools to try and encourage them to think about careers in healthcare, because people look at doctors and nurses, but actually we have healthcare scientists, people working in the labs have come into their own in the last few weeks with all the testing and everything. So, but there's lots of hidden careers in the NHS. So I think, to Beth's point, encouraging people to think about different options is very high on our agenda. The working from home bit is much harder to weave in with that, because inevitably, we do need people on site.
Where you have got people having to go into a physical environment. They are rapidly upskilling at the moment, I suppose. So nurses having to go into ICU units where maybe they hadn't done previously. And there's been lots of talk about clinicians learning new skills. How do you intend to make sure that that aspect is captured and people's new skill sets are encouraged as we move forward and they don't just go back to the jobs that they were doing before and don't use those skills?
Yeah, I mean, that's going to be really important for us because we have trained an awful lot of people at pace over the past few weeks to work in different environments. But actually, I think that's going to continue. So we were talking today about actually we now need to train a whole raft of staff, potentially hundreds, to do swabbing as mass testing capacity increases. So actually, you know, we've got opportunities to do some training for a group of staff that actually haven't had a huge amount in the past few weeks. I think you're right. I think we will have nurses who have learned additional skills. For me, that I'm hoping that means actually some of their aspirations and ambitions grow out of that, and that actually they can see beyond the nursing role they were doing and might want to develop to be a specialist nurse or an advanced nurse practitioner. And all of that will help us in terms of some of our skill shortages and things. So I'm hopeful that we will have ways to capture some of those ambitions that may have sprouted during the past few weeks.
Just thinking about this, we are all, well, predominantly lots of people are now working from home across the country. An organisation like Harvey Nash, we're all working from home. And that previously it was something that was seen as a bit of a luxury, right? When you'd had a length of service at an organisation and it was predominantly managers who worked from home and kind of the view was junior staff needed to be in the office so we can be there to hold their hands and to help them. And those trust issues, I suppose, from management have suddenly fallen apart. And equally, you've got a lot of junior staff for want of a better word, who are now working at home and probably see a lot of benefits from it and might feel quite empowered by this. So how's that kind of dual tension, I suppose, between managers wanting to feel comfortable about the processes at work and the junior staff now going, well, hang on a minute, this does work, and actually, do I need to be kind of logging on at certain times? And how, you know, some of those processes that we used to follow, do they really work?
Don't think they ever really worked, if we're really I think that you mentioned trust. I think trust is absolutely the very heart of how we move forward. You know, we've been thrown into this alien world where we've learned a lot about ourselves and what it takes to actually, you know, thrive in this new world. So I don't want to lose that, and that means that we need to be more flexible. We have to be agile. So if we see something, you know, developing, then we need to follow that trend at speed. Equally, if something drops off, we need to think about, you know, is that an area we should still be working in? And that gives lots of opportunities for staff to work in different projects and therefore, you know, more flexibly in hours. And then back to something I said at the beginning, focus on output. So key metrics, you know, is the work getting done? That's the priority, not when it gets done.
Sorry, how do we make sure that managers are, I mean, Chris, how do we make sure that managers are comfortable with this? Because this is a whole new way of managing people that no one's ever really been taught how to do.
Yeah, well, I think there's a cultural thing in this. I mean, we're in 25 different countries, and you know, some of those, and certainly we've had a discussion at senior levels within the organisation whether they use it wider, and there's a big pushback. Some of those countries are using employee monitoring systems. And, you know, I can look at how many keystrokes somebody's doing a day and work out whether they're doing their job. So you know, I think there's a cultural element in this within certain societies that you know, junior people are not to be trusted if they're at home, and we need to monitor, you know, right down to how often they're actually typing something on a keyboard versus the better way of going, which is by outcomes and that sort of approach. I think in general, we are seeing managers who traditionally were not very open to staff to, as you say, hold their hand, or if you're being less kind, you know, they want to see staff at desks to actually prove that they're doing some things. Now that's gone, we're seeing the work being produced still, and whether or not people are logging on at 6 a.m. in the morning because they've got young children and want to finish doing a chunk of the day before 9 or whatever, or whether they do it from 9 till 5. It really matters not to the management. So if you focus on that outcome-based thing, which we are doing, then unless we identify problems, and there's always going to be 5 or 10% of people who are not going to pull their weight, but in general, we are seeing very positive signs that people can be trusted to work from home, produce the same amount of work, and of course you get the upside benefits of not having to commute and saving all of that time. An interesting thing we did a survey, and we asked employees, again about 3,000 employees globally, if they'd like to work from home going forward, and of course the overwhelming response was yes, an element of our work would be going home. We didn't ask the question, would you like to work from home full time, and would you like to reduce your hours and reduce your pay? But about 30% of our employees actually volunteered that information. So I think people have started to, again, look at the fact that I'd rather work from home more or less full time, and I'm happy to work 4 days a week instead of 5 and only get paid for that time, which is an interesting shift as well.
Mm. Nicky, sorry, you were keen to jump in there.
Yeah, so it was just to build on the point. I think Bev mentioned around diversity earlier. I think there is something about how we use this to attract different generations, because we know that the younger generation want more flexibility, more choice about how they do their work, so the point about, choosing to start at 6 a.m. or actually not starting till midday, but carrying on till 9. Being able to offer that sort of flexibility is important to some generations, not all. There are some who'll prefer to have the structure and coming to the office because that suits their lifestyle. And I think for me, the challenge is how do we try and meet all of those different needs by not enforcing one particular way of working for everybody. And I think, doing a survey to try and understand what your staff want is a great place to start.
Yeah. Well, if I may jump in, I mean,
absolutely.
The structured office environment in many, not all our organisations, but in many organisations of the sort of, open from 8 till 6 or 9 till 5 or whatever, has forced a lot of people into that mindset, and a lot of us who've been doing it for, a long amount of time are sort of probably comfortable. But I think the younger generation who hasn't had many years of the 9 till 5. This has opened opportunities for bringing more of those people into the workforce in a more flexible way. If we carry on, adopting the best of what's come out of the current situation.
One of the things that I guess I'd forgotten is that perhaps when you're earlier in your career, you're not necessarily set up in the ideal situation from your home to work. So you could be in a shared accommodation, and so hanging out in your bedroom all day because that's the only space you could do isn't that attractive. So I think it's made me think as well about flexibility, even if it's in the workplace, is key, and also offering people choice. So perhaps providing some working hubs where people can go in, do their work, and then go home again, maybe more closely aligned to where they live.
Yeah, I think if there's another unique set of circumstances at the moment, which is, especially in the UK and many of countries, we're in lockdown, and therefore there is more of an element of trust in terms of people doing their work, because we know people can't, jump, the classic go to the beach, go to the golf course, go to the pub type thing. So it will be interesting to see, as those restrictions are locked down, whether some of the practices that managers are comfortable now they are comfortable with as we loosen the lockdown.
Everything that you're all discussing is an appreciation of different people's circumstances to our own, and kind of thinking about working environments that we're not used to, or thinking about different groups and how they might approach it with certain barriers, whether they be from a minority group or maybe someone who's disabled and they've got certain challenges that we're not used to. Nicky, I mean, you work for the NHS. There's a huge amount of sympathy and empathy for frontline workers at the minute, and the NHS as a whole. There's a lot more empathy and understanding across society for key workers. I saw Fiona Bruce came in for a huge amount of flack for describing certain job roles as lower skilled, and people kind of going, well, what do you mean lower skilled? People are really quite defensive and showing a lot of empathy for people who are having to deal with this awful pandemic in very kind of physical ways, I suppose. Do you think that level of understanding and empathy is going to survive when we do get 6 months down the line? And I mean, I suppose this is less of a niggly kind of work question and more of just a societal question, but do you think we can hold on to this feeling?
I don't know, if I'm honest. I have wondered that myself. Because I mean, what I worry about, so I think there's a whole raft of key workers. The NHS is one group, but I have as much admiration for, retail, Tesco, people who are working in Tesco who are also putting themselves at risk with shoppers around, and, people doing deliveries, and all the key workers that have been listed. I have a feeling that some of the other key workers will lose some of that. I think the NHS might hang on to it for a bit longer. I think the big challenge for the NHS is, how do we make people feel safe? And if we can come through the next few months, because the next few months will be challenging in terms of trying to start to bring people back for surgery and things like that. How we make people feel safe. So will we come through it still being the golden public sector organisation because we've cared for everybody and kept them safe throughout that period? I think will be a big challenge. But yeah, I was wondering, so how long will clapping on Thursdays carry on for? Because COVID isn't going away, and we're absolutely looking at the next 9-12 months and how we plan for that with COVID still around. But it's not going to be the same crisis COVID that we've had over the past few weeks. So people keep clapping on a Thursday for a year. I doubt that somehow. At some point, I think it will wane.
Well, look, I think that we've probably covered all the topics from a number of different angles. So I want to thank you each for your time. So Nicky, Chris, Bev, thanks for joining us for this particular episode. I want to thank you, Hubs, for supporting and hosting this particular set of conversations. And if you are interested to find out a little bit more around some of these subjects, James Lawson, one of the directors at the Harvey Nash Group, is going to be doing a deep dive podcast. So that will be a sister show to go alongside this. Do explore that. But there are 5 of these episodes. They're being released at once. So why don't you like, share, subscribe, do have a look at the rest of the content. And one last thank you for tuning in today.